What's up, guys? Today we'll be talking about infectious mononucleosis, also known as mono. It should be noted that mono is also known as the kissing disease. Specifically, mononucleosis is a viral infection marked by extreme fatigue, high fever, and swollen lymph nodes. The Epstein-Barr virus, or EBV, is the most common cause of infectious mononucleosis, but it should be noted other viruses can cause this disease, such that it can be caused by HIV, rubella, toxoplasmosis, hepatitis A, hepatitis B, hepatitis C, or the adenovirus. As for transmission, we stated before that EBV is the most common cause of infectious mononucleosis. Typically, these viruses spread mostly through bodily fluids, especially saliva. It can be noted that these viruses spread through blood contact with the body, blood transfusions, and even organ transplants as well. As for signs and symptoms, it should be noted symptoms may not appear until 4 to 6 weeks after you've been infected. Most people get better within 2 to 4 weeks, but some people may continue to feel fatigued. Occasionally, the symptoms of infectious mononucleosis can last 6 months or longer. Some of the signs and symptoms specifically are extreme fatigue, fever, sore throat, head and body aches, swollen lymph nodes in the neck and armpits, swollen liver, swollen spleen, or even both, and even a rash. So who's affected? It's most commonly seen in young teenagers and young adults, especially those in college. At least 1 in every 4 teenagers and young adults who get infected with EBV will develop this infectious mono. Diagnosis. Healthcare providers typically diagnose infectious mononucleosis based on their patient's symptoms. Laboratory tests are not necessarily needed to identify this illness, but if ruled out, then it can be helpful to identify the cause of an illness in people who do not have a typical case of this disease. If taking blood work, then those with infectious mono due to EBV may show. For treatment, there is no vaccine for infectious mononucleosis. However, you should continue to drink fluids to stay hydrated, get rest, and consider over-the-counter medications for pain and fever. As for prevention, and we mentioned before, it's known as the kissing disease, so avoid kissing anyone. Don't share food or drinks or personal items like a toothbrush. As for stats and facts, in the year 2005, the EBV has infected at least 98% of people in the world. It was noted 90% of the people infected with this developed mono. A study conducted by the CDC reported 95% of adults over 30 years old have been infected with EBV at one point in their lives. And as for those people in their 20s, approximately 35% to 50% of people have been infected. Thank you for listening in, and what is this disease is, again, infectious mononucleosis.